is safe, noise for trips and falls. I will close the curtains to provide privacy and dignity to my patient. And since my hands are visibly clean, I'll just do a quick hand rub following the 6-step guidelines of WHO. Assuming my hands are dry, so now I'm ready to approach my patient. Hello, good morning. My name is Anna. I'll be your nurse for today. So I am here to do your assessment, which includes to take your vital signs, your blood pressure, pulse rate, respiratory rate, temperature, oxygen saturation, and I will ask you some questions of your activities of daily living. Is that okay? Okay. So for confirmation that I have the right patient with me, could you please state your name and date of birth as I come to check it with your wristband and assessment chart?
Joseph Blogs, 12 of the 11, 1963.
How do you want me to call you?
You can call me Joe.
Okay, Joe, do you have any allergies to food, medication, latex, or others?
Yes, to penicillin.
What type of reaction do you experience when taking penicillin?
Rashes.
Okay, I'll take note of that, making sure that everyone is aware so you will not be given penicillin during your stay, okay?
Okay.
Are you comfortable?
Yes.
Are you in any pain?
No.
No. So I'm just going to prepare the things, okay? So I have the equipment with me. I made sure that the machine is well calibrated, clean, and serviced. So I'm happy to use it. So I'm going to get your blood pressure first. I have the right cup size for you. By the way, have you taken any hot or cold food drinks for the last 30 minutes?
No.
Have you rested for about 30 minutes?
Yes.
So I have the right cup size for you. Do you have any arm preference?
No.
Or do you have any arm restrictions like fistulas?
No.
None. Or any surgeries?
No.
So, can I use your right arm?
Okay.
So I'll put the cup 2 finger press above the antecubital fossa, and then the brachial mark should be in a line with the palpated brachial artery. It should not be too loose or too tight to have an accurate result. And the cup should cover 80% of the arm's length and 40% of your arm's width. Right, Joe, sorry, you will experience a little bit tightness once the cuff inflates, but it will be gone once the cuff deflates, okay? So while waiting, I'm going to get your oxygen saturation on the other hand. I will use a finger which has no varnish and with a capillary fill of 2 to 3 seconds. While waiting, I'm going to get your temperature using this tympanic thermometer. Don't worry, we use different probe cover to prevent infection, okay? Do you have any ear pain? No. Do you have any ear preference?
No.
So is it alright if I will touch your ear? Yeah. I'm going to pull your pinna up and back. Then you will feel a little bit discomfort, but once you hear the beep sound, it's done, okay? So your temperature is 36.3. I'm going to throw this into the clinical waste bin. Is it alright if I will document the result first? So you are Joseph Blogs. Date of birth is 12/11/1963. Date admission is today. So your temperature is 36.3, which is normal. Your blood pressure is 103/71. It's normal as well. And your oxygen saturation is 100%. And you don't have oxygen. Is it alright if I will touch your wrist? I'm going to get your pulse rate for 1 full minute. Alright, so Mira, your pulse rate, Joe, your pulse rate is 73, which is normal, not boundy or thready. And Joe, I also counted your respiratory rate for 1 full minute without you knowing it so I can get an accurate result. And it is 22. It's a bit high, but it's regular and you did not use any accessory muscles. And you're alert. So your total mu score is 2001000. So your total mu score is 3, which warrants me to do your monitoring every 4 hours. And no escalation needed. Or if your clinical condition changes, okay? Right, so Joe, I'm going to ask some questions about your activities of daily living. Is that okay?
Okay.
Right, so for your breathing, do you normally experience shortness of breath?
Yes.
Yes. Do you use an inhaler?
Yes, I have.
Yes. Is pain affecting your breathing?
No.
No. For your eating and drinking, have you experienced any loss of weight?
No.
No. Do you have any difficulty swallowing?
No.
Do you have any special diet?
None.
No. For your elimination, have you passed urine for the last 8 hours?
Yes.
Do you experience any problem?
No.
How about opening your bowels?
Fine.
It's fine, no problems
No
as well.
problem.
Yeah. For your mobility, are you normally independent?
Yes, but because of my asthma, I tend to walk short distance only.
Right, so if you need anything, here's the buzzer. Just press the buzzer so we can attend to you as soon as we can, so we can assist you to go to the toilet. Okay? Or we'll give you inhaler first before you mobilize to reduce your shortness of breath. Okay? For your sleeping, how many pillows do you use?
I usually use 1 pillow, but whenever I'm having shortness of breath, I tend to use 2 to 3 pillows.
Okay, so if you need more pillows, just let us know so we can provide you one. Okay? How many hours do you normally sleep in a day?
Before, I usually sleep 6 to 8 hours, but now, because of my shortness of breath, I only sleep like around 4 to 5 hours.
Okay, so I think before you go to sleep, we will administer a nebulization or inhaler so to ease your breathing and you can sleep well. Okay? And you need to be in upright position so that you will not feel shortness of breath. Do you live alone or do you live with somebody?
I live alone.
You live alone. I think I've gathered all the necessary information from you. Rest assured that those information will be kept confidential. Do you have any more concerns?
None.
None. Okay, so thank you for your cooperation.
Thank you.
Thank you.